morning, everyone. Myself and Dr. Vidya today will take you through an interesting presentation which says Beyond Science, the Art of Being a Family Physician. Now, despite the enormous advances in the science of medicine, the interpersonal encounter between the patient and the physician still remains the keystone of medical care. And this interpersonal encounter can be probably considered the art of medicine. And this was realized long time back when Sir William Osler mentioned that it is more important to know what patient has the disease than what disease the patient has. So what is our role as a family physician? It is very well depicted in the Wonka tree, which categorizes into 6 categories, which is seen here, but all of this is dependent on the 3 main key features, which is the root of the tree, which mentions the attitude of the physician, where the physician has the values, the ethics. The science is the physician updated with the latest knowledge. And third, it's a contextual science. So in what context are we treating the disease is important. Moving on to the qualities of an ideal doctor, the patient perspective. So let's explore what the patient thinks is in quality of an ideal doctor. Every patient wants a thorough and knowledgeable doctor, but it is also important that we are honest about knowledge gaps. I tell you this because we all know as family physicians, the width of our knowledge is more than the depth. So we don't know what patient would walk in next. So it is important that we know everything, but may not be in that depth. But it is also seen that it is appreciated if you accept the knowledge gaps and be honest about it. Listens to the patient. Now, listening again means that both what the patient is telling you up front about what he has come to you with, and it is also important to pick up the nonverbal cues, which means that if a patient is looking worried, what is the body language of the patient is walking in the chamber with? So that needs to be addressed as a physician. Empathetic. Now, empathetic is often confused with sympathy, but empathy essentially means that if you're putting yourself into the patient's shoes and understanding what the patient's problem is, that gives a better understanding of a problem and a more satisfactory consultation. Being forthright. To give you an example, in a case of breaking bad news, when you're breaking bad news regarding a cancer or diabetes, it is very important to provide the correct information, keeping in mind other things. We should not be hiding any information from the patient. And last but not the least, it is every individual demands respect. So it is a good idea not to be judgmental and give that respect to each patient that comes in. So are we different? Yes, we are, because we are the physicians who are closest to the people, because we have the deep connection, we care with compassion. And we, with our interpersonal skills, can often dissect out this kind of a tangled mass of difficulties, which so often we see it forms the core of functional disease and sometimes magnifies the symptoms of any organic disease that we see. So all that we've talked about till now, how do we simplify it and how do we implement it in our day-to-day practice? 3 simple things we have to remember. One is we have to use time as a tool. So keeping all these things in mind, it is important that we fit it into that 10-minute consultation and as well as make it a satisfactory consultation. And how do we overcome these hindrances and go ahead? We have to elicit the ideas, concerns, and the expectations. Now, by ideas, we mean the beliefs or the opinion. Again, to give you an example, if a patient walks in with fever, now what is the patient thinking he has? He may be having a fever, but he thinks it is dengue. It may not be, so it is our responsibility to explain it to him. Concerns, again, is worries. Worries meaning that suppose a patient comes in with a dry cough for 2 months, but when you ask him that, is there anything else bothering you with the cough? He just might be thinking that it is a tuberculosis that worries him because his friend or a relative has got it, or a cancer which his uncle is suffering from. So if we don't address it, then the patient is not satisfied out of the consultation room. And finally, the expectations, which is the hidden agenda with which the patient has come. So if a patient comes in with fever and has to travel in 2 days, so the patient is expecting an antibiotic out of you. So antibiotic may not be required because it's a viral upper respiratory infection, but that is the agenda, and it is again our responsibility to explain it. So we can really make the difference if we have unraveled this hidden agenda and take it forward. So now we will just show you a video in which we will not talk about the history much because we all know how to do it. We're just going to show how we have elicited the ideas, concerns, expectations. So we'll show you the full video first, and then we would show you it in parts, mentioning where is the idea, where is the concern, and where is the expectation. All right, so shall we go ahead?
Blood test? What blood test would you want to do?
Well, I wanted to do that test because I thought that will help to identify my fever. So, yeah.
Sorry, I didn't get you. Which test would you want to do?
Oh, I wanted to check for HIV test.
You look worried, and HIV. Why do you want to do an HIV test?
Well, doctor, I've been having the fever, and I've done a lot of tests, and all the tests have come negative. But I had a dengue infection 6 months ago, during which time I had a blood transfusion.
I see.
So, because the fever is also coming, right, so I thought I should get it checked.
So you're worried because of the blood transfusion you could have acquired an HIV infection, is what you think?
Yeah.
Yeah,
That's one of those things, right? Because somebody told me that with the transfusion you can get it.
True. Anything else which is bothering you, I mean, which makes you think of HIV?
So, I'm going to get married soon, so the next 3 months.
I see.
So, I had a physical relationship with my fiancé, so I was just thinking, could it be the transfusion or because of the physical relationship? I'm not sure. But
I do understand that you're worried for both reasons.
I'm very worried because the fever is also coming and I had all the tests done.
Right.
So, but could be HIV as well, right? So
Right. See, at this point in time, you say that you've been having recurrent fevers and you're thinking of HIV, but we don't have anything, any tests in hand now. So what we would do is we would take it step by step. So initially, for the fever that you have now, I'll treat you for that. Since everything else looks normal, you've got already a battery of tests done, and everything looks perfectly normal. So I'll put you on some symptomatic treatment in the sense that I'll give you medicines for fever and a lot of fluids, and I see you back. But yes, you're rather concerned for the HIV test, and rightly so. If you're getting married, it is important for us to do it. So what I would say is that we have a screening test
okay,
initially.
because I wanted to get it done. That was one of the reasons I had come. But
Yes.
I just want to make sure that the results remains confidential, because at this point I don't want to discuss with anybody on that. And
You can be rest assured about that. There will not be any, and nobody will come to know about it. But it's good that you thought about it, and it's also important that we do the test. So surely we'll go ahead with the test, and then I'll meet you with the reports.
Okay.
Thank you.
So, I hope we have been able to show how to elicit patients' ideas, concerns, and expectations. It's mainly to go in detail about, it's all important, whatever the presentation might be, everybody has their own thoughts. Like, it's very, very common that patients have their own thoughts about this is what is my problem, I need to work on it, can doctor help me? Unless we ask them, they will not tell, unless it's a very, very simple one. Let's say if they have a fever, then they will say I have a fever. But if we ask them in detail only, then they will have some issues and they will talk about it. So that's what we wanted to highlight. And if we can incorporate during our every session with our patient, this will definitely make us a better doctor. As a general practitioner, we should all be working on it. So I will just discuss one case today because we have 3 cases. but I just gathered from the organizing team that we all have to assemble down for our union minister presence. So we'll all have to be there before he comes to the main hall. So we'll just have one case discussion where we would like to discuss with the delegates here, what do they think about it. A 28-year-old lady attends to our clinic with headache lasting for 4 weeks. No associated upper respiratory tract symptoms, no trauma, no vomiting, no eye symptoms. She got married recently, 3 months back. She works as a school teacher. She denies any stresses at work. Cycles are regular. Last menstrual period was a week ago. No history of smoking and alcohol. Our examination is perfectly fine. So this is a lady who comes to the clinic with these symptom of headache. How do we go from here? Using our technique of ICE, ideas, concerns and expectation. So putting the question back to our patients, asking them what do they think could be the cause of the headache, because we have ruled out all the organic causes, right? We know that there is nothing sinister sitting there which is causing the headache, but she is suffering, that's why she is here in the clinic. So we need to ask her what brings her to the clinic, what she thinks is the problem, and then if we explore her concern, we will be definitely able to address her problem much better. It is so simple to write analgesics and tell her take this medicine, and also it's easy to tell, right? You need to relax, take a deep breath, do some breathing exercises and have a break. These are the good things we can quickly say and send them out of our consultation room. But we wanted to be a different doctor, so we wanted to show that as a family doctor we can do much better compared to just writing a prescription, few medicines and handing it back to them, which doesn't solve the problem. She's going to come back to you again or go to another doctor because her ideas were not addressed. So she's going to go back to another doctor, and at the end of the day patient is not treated properly. So from our side it is very, very important to emphasize that explore the patient's ideas and we will be able to perform well and treat our patients well. And this was one of the real life scenarios. So the patient came, revealed that she's been having issues at home. As ma'am was correctly telling, there has been some issues with domestic violence. We do ignore it during our consultation. Unless we unravel it, it will not come back again. And she's going to go through more trauma by not revealing it. So this is what we wanted to highlight. We do have few more cases, but because of our lack of time, we have to go towards the end of the slide. So I'll request Dr. Roshni to come back again and go through the summary points. Thank you.
Right, so as rightly pointed out by Vidya, so the take-home points from this presentation would be that understanding the ideas, concerns and expectations lead to a successful consultation. It is only good communication that can help to elicit ICE, and we as family physicians, we deal with uncertainty in our day-to-day practice. So this is one thing that will help us to deal with uncertainty. And at the end, yes, it avoids us doing unnecessary tests and treatment. So finally, addressing the ICE ensures that it is a patient-centered consultation and doctor satisfaction. So that is what we had to say. Thank you so much.